Good morning, radio stations. Stand by for a 10 o'clock start of the press briefing for today, Friday, the 17th of November, from the Financial Center in Roseau. Stand by for 60 seconds. Radio station, stand by for commencement of today's daily press briefing in 35 seconds. Radio station, stand by for commencement of today's daily press briefing in 15 seconds. In 10, 5, 4, 3, 2, 1, and
good morning, one and all, and welcome once again to yet another of the daily press briefings hosted by the Office of the Prime Minister in the aftermath of Hurricane Maria. I am Kamala John Baptist Aaron, Press Secretary for today, Friday, the 17th of November. The press briefing will focus on the Ministry of Health and Environment. As you may be aware, in the aftermath of disasters, health is a sector that comes into sharp focus, and without question, especially in the aftermath of a disaster such as the one we had with Hurricane Maria on September 18. You may be familiar already with how the briefing goes, but I will remind you, we will have speakers come to the podium, and after that we'll take questions from the media who are present here this morning. And I thank you once again for your presence here on site in the media room in the Office of the Prime Minister. We will start this morning, before we get to the Minister for Health and Environment, we will start with an introduction by the Permanent Secretary in the Ministry of Health and Environment, Mr. Davis Leighton.
Thank you very much, Mrs. John Baptist, and let me say good morning to our listeners in Dominica and in the wider global community listening to us this morning as we bring you this update on the Ministry of Health and the Environment. Today we are just 1 day short of 2 months after Hurricane Maria struck the island of Dominica. The health sector, as you heard and as we all know, is one of those that has been severely impacted by Hurricane Maria. And as you heard from our moderator this morning, the health sector is also one of those that come into sharp focus, where a lot of attention is placed post any disaster, not just hurricane. Based on the preliminary assessment of the figures of the post-disaster needs assessment that was conducted a few weeks after Hurricane Maria, our loss and damage to the health sector stands at 18.8 million EC dollars. And in terms of our needs, what we require to make the sector more resilient and to take into consideration impact of climate change, we're looking at approximately 59.7 million, we could say roughly $60 million to bring the health sector to what we would like it to be post-Hurricane Maria. This morning, I am certainly pleased to report that despite the damage that we suffered under Maria, that the health sector continued to function. One of our volunteers who came to us after Hurricane Maria indicated to me that really I see a system, and that was days after Maria, a system that is still very functional. And for this, commended the Ministry of Health, because we were able, despite the challenges, to continue most of the regular services that were provided within the Ministry of Health. I am also grateful to the number of healthcare professionals who really displayed strong heroic act to ensure that those services were maintained throughout our health system. We also recognize the contribution of our many volunteers from the various organizations, and I take it that later on in the presentation this morning, you will get an idea of all the organizations that contribute and are still contributing to ensure that the health system continues to function. Post-Hurricane Maria, we continue to focus on provision of care and treatment at our hospitals, the Princess Margaret Hospital and the Regional Armour Hospital in Portsmouth, and our health centers across the island. We also continue our focus on disease surveillance because that is very important post any disaster. On health education, and I'm sure you have been listening to all the health education tips that we have provided you. On psychosocial support, which is very critical as our population continues to cope with the post-Maria experience. On solid waste management, on health and safety, to include occupational health and safety, among many others that the ministry continues to work on. This morning, we have a very strong, committed team from the Ministry of Health to update you on some of those matters, as well as other matters of health. We have the Honorable Minister of Health and the Environment, himself a health professional, our Chief Medical Officer, Dr. David Johnson, the Director of Primary Health Care, who is expected to join us very shortly, the Project Coordinator in the Project Management Unit for the new National Hospital, the Acting Chief Environmental Health Officer, the General Manager of the Dominica Solid Waste Management Corporation, Mr. Florian Michel. We will begin with a statement from the Honorable Minister, and that will be followed by a presentation from the Chief Medical Officer, the Chief Environmental Health Officer, the Manager of Solid Waste, and then we will invite the press to ask any questions that you wish, and then the rest of the team will also contribute at that point. Thank you. Honorable Minister.
Thank you very much, P.S. Slater, and we will now invite to the podium for a statement the Minister for Health and Environment, also the Member of Parliament for the Petit Savan constituency. Important. Honorable Daru.
Thank you very much, Mrs. Aaron, and also Permanent Secretary Mr. Leta in the Ministry of Health and the Environment. I know that both of you mentioned a statement. A statement is something that is well prepared. I would rather have said that to speak to the press and, of course, to all the many listeners, of course, across Dominica, across the region, and further afield. This is my very first official press briefing since Maria as a Minister of Health. So as one can imagine, I might have quite a bit to say, although I will leave the finer points to the more apt technical staff, the technocrats here with us. But let me just say, first and foremost, thanks to the organizers of this press briefing for having the Ministry of Health this morning, and of course for allowing me to speak. Let me just say good morning to everyone present here. And again, as I said, and Mrs. Aaron mentioned, importantly, the residents of the Petit Savan constituency, and of course the wider Dominican public, our regional counterparts, and I'm sure all of those listening watching via YouTube, the Prime Minister's Facebook page, among many, many, many other media. Let me begin, of course, first by offering my own personal condolences and on behalf of the those of the Ministry of Health to all those, of course, who suffered loss, death, of course, missing, presumed dead, and of course, those who lost property, material loss, which would be all of us in here, I presume, due to the passage of Hurricane Maria. It's been, I think, 1 day to 2 months that we had that Dominica experienced the passage of Hurricane Maria, which really was something I think that none of us prepared for. I like to refer to it as a Category 10 storm, because I think they stopped, from what I've been told, they stopped at the Category 5, but if you look at the increments from 1 to 5, I think based on what the experts told us, with gusts of 200 or 220 miles per hour wind. I would like to think this would have taken us into the category 10 or maybe 12 zone. So I really would like to express my condolences to all those I said who suffered loss during Maria. And before I go into the gist of my presentation, I really would like to join the Permanent Secretary in expressing my own sincere thanks to the staff of the Ministry of Health. And I will begin with the Permanent Secretary and the administrative staff, the Permanent Secretary, the CMO, PNO, who says I like to forget her sometimes, the Hospital Medical Director, my Director of Primary Healthcare, in fact, all the other heads of department, who I think whose dedication and whose work was exemplary in the aftermath of Hurricane Maria. This being said, equally as exemplary would be the work of the medical teams in the various districts at the Princess Margaret Hospital. The commitment and dedication shown by this staff, was exemplary. And I can tell you, I being frozen on the ground in Grand Bay, not being able to move from Grand Bay, and basically lived at the health center for the first 7 days or so after the storm. And again, I would like to add that if we could carry some of this dedication, that's a percentage, 10% of this dedication and commitment that was shown post-Maria going forward, I think we in Dominica could have a health system that the whole world could be proud of. Again, yes, these were extraordinary circumstances, and I like to say that extraordinary situation that called for extraordinary efforts by extraordinary people. And I think the staff of the Ministry of Health proved just that they're really extraordinary. So starting from the Permanent Secretary all the way down to the janitors at the various health centers, I would like to thank you, sincerely thank you for the work that you have done, you did, and continue to do in the aftermath of Hurricane Maria. As it pertains to, of course, a regional and international cooperation, I too would also like to express my thanks to all. And again, as the Permanent Secretary said earlier, during the course of this event, of this activity, I'm sure you would get a comprehensive list, an exhaustive list of all the organizations who would have rushed to our shores, some of them even probably the day after Maria, probably the night in some cases, and continue to come in to offer the assistance to the Ministry of Health and, of course, the Commonwealth of Dominica by extension. And time and space will really not permit me to mention all of them, but there are a few that I think we need to mention, like PAHO, who has continued to be a great partner to the Ministry of Health, and in fact to all the member countries of the organization. But here in Dominica, we can attest to the fact that PAHO has always been there for us. We can speak to Israel, our Cuban friends, our Venezuelan counterparts, our CARICOM brothers and sisters who would have sent both doctors and nurses, and Hands International. We can speak to Electricians Without Borders, Electriciens Sans Frontières, I think it's said in French. If you could, if I may be allowed to try my tongue at French. So all of these organizations, I said, who would have rushed to our shores, we really want to thank them. And even as we speak, we have organization groups and people who continue to come in person, others through various media, telephone, email, would have expressed the interest in continuing to assist Dominica. Because whilst we're out of the woods per se in terms of the immediate post-disaster period, we still need a lot of assistance. We have a health system to rebuild, and of course a much more resilient one. Because you would have heard the statement of the Honorable Prime Minister as it pertains to building a climate-resilient country. And a climate-resilient country does not only speak to the infrastructure, it speaks to all sectors, being a climate-resilient health sector also. Of course, we would have started this journey even prior to Maria. Those of us and all of us in here, I'm sure, familiar with the SMART project, a Smart Health Facility project funded by DFID and being implemented by PAHO. And as we speak, the project would have already started in La Plaine because we would have identified 3 health facilities for smarting, quote-unquote smarting. In fact, that turned out to be one worked out a little against us because the temporary building where the Type 3 Health Center was being housed during Maria, well, prior to Maria rather, would have suffered extensive damage while the project would have started on the actual Type 3 Health Center, or the permanent structure rather. But since then, thanks to wonderful staff like my director, the PS, etc., the temporary building or the building that's being leased in the interim has been repaired and work continues on the Type 3 Health Center in La Plaine on smarting. Now, what is smarting? And of course, in light of Hurricane Maria, the issue of the smart health centers comes into sharp focus and even more relevant. Why? Because the smart, I'm not sure if it's the same smart that the IT people use, but what this still means is that to make these facilities much more resilient and to make them continue to serve people, especially in a post disaster, because this is when, unfortunately, that the service would be needed the most after disaster. So we would have had a few examples, for example, of generator failures and even extensive damage to buildings in various communities post-Maria, and we all know what that would have resulted in. People who will be sick, people need the maintenance drugs, people need to visit the doctor, etc. And if they cannot do that in the post-disaster period, then we know that the effect of that could be even worse than the actual disaster itself. And in fact, to tend to the injuries and the traumas, etc., experienced during the actual disaster. So we need to ensure that our facilities, especially the Type 3 facilities, in fact, all our facilities should be up and running even during the disaster and immediately thereafter. So this smarting would include, of course, the issue of having a supply of potable water, even when our normal water system would fail. The issue of energy. So while all of the Type 3 health centers would have been outfitted with generators, some of these generators would have also suffered damage because the housing would have damage, etc. And in the case of Grand Bay, we had a failure for a day or two because of flooding, etc. So we need to look at renewable energies. In other words, what happens on the outside should not affect the health center. The health center should be, of course, you will expect maybe the little window broken and stuff like that, but the health center should continue to function with a proper source of energy, potable water, etc., so health services can continue. So we are continuing full steam with our smart health facility project. I think I mentioned earlier we would have identified 3 health facilities in the first instance: Grand Bay, La Plaine, and Roseau, if I recall. But we would have had a few others carried in for the shorter term, Marigot, Portsmouth. So what we've done since Maria, we would have spoken to, of course, our benefactors, the donors and DFID, to let them, to ask them whether they couldn't fast track, the funding for these other facilities. And so far, there are positive signs that this will be done. So the health sector, like all other sectors in Dominica, we did suffer damage, infrastructural damage, among others. And of course, even I think more profound would be the fact that the staff who would now be required to provide services to the people, injured people who are sick, people who require in the maintenance, the continued management, health management, they themselves would have left their homes. If some of them have their roofs uncovered, and now have to put all of this behind them to treat people, which is why I think that post-Maria, the example showed by the staff, by our staff, was really needs. I mean, it really cannot be underscored enough that they had to put all of this behind them to continue. Some of them I know days away from their home, 3-4 days at the health facilities, and knowing that their roof would have gone, the flooding, etc. But they had to put all of this behind them to continue serving people. So, which is why I really need to underscore our sincere thanks at the Ministry of Health. In terms of infrastructural damage, I don't want to spend too much time on that. I think we should focus on recovery, which 2 months since Maria. But we know PMH did suffer extensive damage, PMH that is. As we speak, repair works are in full swing, although I have told the PAs that we need to light some fire under the parties concerned, because I think 2 months after Maria, I think by now that the entire PMH should be covered. We are hoping that in the coming weeks, in the coming week, we should be signing contracts with multiple contractors, because there's no reason why we should be having one contractor doing one part of our main and only hospital, moving on to the next. So why can't we have 5-6 contractors each engaged in a particular part of the hospital? So the PS is on board with me in this regard. So we are going full steam ahead next week. Unfortunately, some of the with the ongoing work of the new National Hospital, some of the temporary buildings like the lab, etc., would have been flattened, but have been advised that since then our laboratory services and etc. would be up and running. As it pertains to the health centers at the rural or the community levels, I'm pleased to announce that all our 7 Type 3 health centers are up and running. As I said, the only difficulty we would have had would have been with La Plaine, because it was being housed in a residential building while work was being done to smart the original Type 3 health centers. But since then, all work has been done and La Plaine services continue Type 3 health center. Unfortunately, not all of our type 2, that is the smaller ones in smaller communities, would have suffered, would have been so lucky. I can speak to Pishna in my own constituency, where it was obliterated is a word, where there's no evidence that even a building existed there. Slide took it and then the river did the rest. Not all of the damage in the other facilities were as dramatic, but we would have suffered various degrees of damage to the other type 2 health centers, which we are working fervently to. Type 1 health center, which are working fervently, of course. In areas where the health center is not usable, we would have engaged in listing private homes available at it, and I'm sure you could appreciate the difficulty in getting an available home, but the Ministry of Health staff, under the astute direction of leadership of our young director, up-and-coming director, would have made it possible where they could get buildings to be leased and services continue. In terms of electricity, all our type 1 health centers have been powered, thanks to Electricians Without Borders, Electriciens Sans Frontières, practicing my French again, Sans Frontières, would have provided generators to all of the type 1 health facilities. All except 5 are functional now, and of course these 5 would be these that have been extensively damaged, and of course going forward we have to come up with a strategy as to whether these health facilities are worth repairing, or we consider demolition and building a new facility. Of course I need a new facility in Pishna PS. Okay. The new National Hospital, I'm sure lots of questions around it, I'm sure, but just to put your mind at rest and the population, that the new National Hospital will continue. In fact, may I dare say now more than ever, because this new National Hospital is being built, of course, with existing standards, not existing, what's the word I want to use, standards that would withstand these natural disasters. So now more than ever, we need to continue with the new National Hospital. Of course, as we discussed within the ministry, the scope might have to be reviewed a bit. So while we know it was being built to withstand hurricanes, we now know that the Category 10 hurricane exists. Don't quote me on this, it's just me, but the Category 10 is just my own coding of it. And we have to clearly, of course, review the scope of work of the new National Hospital, and not just the new National Hospital, any facility that we will be building from now on. And by those of us, again, familiar with the budget would know that on the cards we had new facilities to be built in Vickers, Newtown, Bellevue-Chopin, again, my constituency, Corleho. So, of course, as I said, these are being reviewed. Obviously, the scope of works have to be reviewed, especially in keeping with the government and Prime Minister's announcement as it pertains to building a climate-resilient country, the world's first climate-resilient country. Marigot, we have to continue. The Marigot Hospital is still on the cards, and in fact, just yesterday would have gotten the good news from the government of Mexico that the final signature has been put to the funding for the Marigot Hospital. We knew that a commitment was made, money was approved. So at the Ministry of Health, what we're doing, we are finalizing the tender documents towards the demolition of the old Marigot building, so the site can be cleared, and then construction begin on the Marigot Hospital as soon as possible. Again, as I said, no more than ever, we have to ensure, of course, we've reviewed scope of works to ensure that the Marigot Hospital is built, given its strategic location in the northeast, airport or main airport, etc. As it pertains to the Marigot Health Center, this is still being discussed at the ministry level, because there has been this different school of thought as to whether it should be in the vicinity of the new hospital or whether we identify another site. So this, of course, has to be finalized. But we are going full speed ahead with the new Marigot Hospital. Again, I said no more than ever. Again, as I would have mentioned earlier, prior to Maria, we would have engaged the services of UNOPS, United Nations Office for Project Services, I think, something of that sort, towards the designs and of course supervision of works for that particular project. So we are engaging just the very best for this particular project. Post Maria, of course, we would have had a number of issues, as we know, with our medical supplies, pharmaceuticals, CMS, Central Medical Stores, of course, suffered extensive damage, the roof. So we would have had loss of stock. I'm sure the PS or the CMO, one of the others, will give the actual percentage of loss of stock. But we want to really thank our partners, regional, international, and even individuals who would have come forward with donations as it pertains to, first of all, emergency stock, post-Maria, and of course in the longer run replacing some of our maintenance drugs for hypertensive, etc. So I really want to thank all of these. Again, too numerous to mention. Just want to say a big thank you to all who would have come forward and donated. We spoke about the type 3 health centers already. Repairs to PMH, I mentioned is ongoing. We would have already done Alford Ward, albeit temporarily. We still might have some other works to do. The ICU, they have moved on to Dublin Ward. So as we speak, I think maybe just 3 or 4 more sections of the PMH should do. I think the old APU and a couple of the sections at the PMH to be done. And again, as I said, I've already discussed with the peer that we need to move with this full steam ahead. Going forward, the plans of the ministry, all our plans, if you would have realized during my presentation, all our plans, we are going full steam ahead with all our plans. Of course, as I said, there will be some review as it pertains to infrastructural work, review of the scope of works. The new health insurance continues, and I think now more than ever, the issue of regional, of even expanding this to a regional health insurance program is brought to the fore, and I'll tell you why. Because we saw the need for the evacuation of a number of our citizens post-Maria with damage to the hospital, of course them injured, and again days after, or the medical cases that were too complicated to be handled here, especially in light of the damage to the Princess Margaret Hospital. And the issue of regional insurance has been on the cards, on the topic ever since I became a minister 8 years ago. It's been that long. 8 years ago, that to facilitate the movement of our people seeking medical service within the sub-region and even the wider CARICOM region. And in fact, just coming, Permanent Secretary Leighton and myself would tell you that just coming from a meeting in Martinique, OECS Council of Ministers meeting, the 4th hosted in Martinique, and of course Martinique now being an official member of the OECS, the issue of this regional insurance came into sharp focus. So while there's been this ad hoc arrangement between Dominica and a number of the other OECS countries and Martinique for medevacing patients and even outpatients seeking medical assistance, we think the time has come for us to formalize this arrangement. Martinique, of course, being a country very advanced in terms of its medical health sector, radiology, laboratory services, among others. We think the time has come now for us to formalize, even between country and Martinique, or even at the OECS level. So the OECS Commission had been mandated to pen a draft memorandum of understanding to member countries to be sent, for, of course, for review by the individual respective countries, rather, for eventual signing after cabinet and, of course, endorsement. So legislation, we want in the very near future to take to Parliament a medical act. In fact, we've been asked by the Attorney General office to put the two of the legislation that we want to be given urgent attention, the Medical Act and other associated acts like the Nursing Act and Associated Medical Services Act. And even more importantly to me, and even dearer to my heart, would be this new environmental legislation. And I know I sound like a stock record because this is legislation we've been working on since I took on the portfolio of Minister of Environment 8 years ago. This legislation has been drafted, and we're hoping that sometime in the near future that we can take this legislation to Parliament. And I'll tell you why. Especially in view of what happened post-Maria, and especially in light of the Prime Minister and government's statement as to making Dominica the first climate resilient country in the world. This legislation is going to be super, ultra important, because this legislation deals with establishing in-house offices, in-house agencies that are going to deal with the issues of climate change. Because while we hear of billions of dollars out there for climate change, some of this money will not come down to us unless we have our in-house, unless we do everything at home and everything set up. So this legislation, I think, is going to be play a pivotal role into manifesting or realizing this vision of making Dominica the first climate resilient country in the world to leverage this much needed funding. Solid waste, the manager is here and I'm sure he'll speak to it, but just quickly, again, all of us in here are press people or in the hierarchy of the Ministry of Health, and we would know that we would have seen an increase in the subvention to solid waste in this year's budget, and also money is put aside for the procurement of 2 new compact trucks. Unfortunately, the procurement of the trucks didn't come through before Maria, which would have really helped us had it come through before. But of course, we're hoping that we can continue the process. I think they've already been sourced, and it's just a matter of making the payments, etc. Going forward, the plan is that we would use, of course, purchase a few more of these compact trucks to deal with the urban waste collection, and in the rural communities, or what I call the rural communities, that we could outsource this service. So this, of course, is being discussed to facilitate, and I really want to thank Mr. Mitchell, the General Manager of Solid Waste, for really making things happen under very difficult circumstances. We know that the corporation has been under serious difficulties, and we really want to thank you for making things happen, Mr. Mitchell, you and your staff. So medium to long term, of course, we're looking at the upgrade of the landfill, and of course the issue of purchasing and implementing new technology, recycling, etc. We would have been in talk with a number of interested business ever since, again, 7 years ago. Interested in doing business as it pertains to solid waste management. Okay, so we're looking at about 3 or 4 promising proposals, of course, and in the coming weeks or so we would roll out if these proposals are accepted by us. We want to also thank PAHO for an incinerator at the hospital to deal with our biomedical waste, and then the plan is that another one be purchased for the district to deal with the biomedical waste, because really and truly, as exists now, it's really not the ideal way to deal with biomedical waste, what is happening right now. So we want to thank PAHO for this. What else can I say? But I think it's opportune that I speak briefly to the situation ongoing at Kubuli, because I'm sure the press maybe I see Mr. Morris here spoke up. I'm sure he's on top of it and will probably ask questions. So I'm one of these people who like to say things, so then I don't give you a chance to ask any questions after. The situation at the Kubuli factory. We know that Kubuli, like many other buildings, suffered extensive damage during the passage of Hurricane Maria. I keep on saying Erika, of course, because Erika would have been on my tongue, on my mind a lot. Hurricane Maria. Now, couple weeks after Hurricane Maria, we were informed, questionable ways, but informed nonetheless, as to the presence of ammonia at the old Kubuli factory. I think the damage would be the river would have passed through the plant, plus a few slides, etc. But we were ensured that the ammonia at the factory would be safe in contained tanks. Of course, the DBBL, Dominica Beverage and Brewery Limited, I think I have that correct, would have assured us that they would be doing periodical checks, monitoring the presence of ammonia in the immediate area. Up to about a week ago, there was no measured ammonia in the area. But about a week ago, they noticed that there was this ammonia, this small leakage, which unfortunately has been increasing on a daily basis. So here we were caught between the devil and the dark blue sea, and something had to be done. So they would have engaged, that is the DBBL, would have engaged a highly specialized team from mainland USA and Puerto Rico to come up with a plan to get rid of this ammonia, because this ammonia cannot remain there, because God forbid, and I think to make matters worse, the site of the leak hasn't been identified. So they're saying that while they assured us that the leak is not coming from the contained system and it could be residual in their piping system, because I think the ammonia is being used for refrigerants, etc., for the cooling system, they still haven't been able to physically or visibly identify that particular leak. So what do they have to do? We had to get rid of the ammonia that is contained within that vat or whatever container it is. So it's an internationally accepted process, what they call of degradation, where this ammonia is now going to be passed through water and neutralize it. So this is what is happening at Kubuli as we speak. Of course, to allow that to happen, a number of stakeholders and other government departments would have had to get involved. The police, the fire service, the health ministry, among others. And on this note, I'm sure a number of the residents in the area will be listening to this press conference. I really want to thank the residents of this area, especially those in the vicinity of the plant, who would have really cooperated very well with us, even the notice was a bit late to agree to move out, because there were 3 or 5 houses, 3 homes, I think, in the immediate, in the vicinity of the plant, that it was recommended that they be evacuated during the course of this 12-hour course of the procedure. But just to reassure Dominicans that all is in place to ensure the safety of the citizens. And as I said before, the process which is being engaged, they've been done by a highly specialized team, and is an internationally approved process, which is the degradation of ammonia. So the road would have been closed from 9 o'clock this morning to 9 tonight, of course, with intermittent allowance of vehicles along the road. So we're hoping and, of course, praying that all goes well. Of course, there's certain risk involved, especially when you're going to tap into the vat containing the ammonia, might have a little escape of ammonia. But this is being monitored constantly. And of course, the public will then be notified of any mishap. And I'm pretty sure, I'm an eternal optimist that there's going to be no mishap. That's correct, right? Okay. So I think I covered all what was on my mind and my heart. Just to say one more time that I really would like to thank the health, each and every one of you. I mean, within the various departments, head of departments, and your staff. I'm sure in the near future that we'll be reminded. I will be reminded as a minister that I had high praise for them, and now is the time to show it. Yes. Okay, especially when negotiations come around, salary negotiations. But I really want to say that there are rewards that are far greater than monetary figures. But the work that they did, honestly, was exemplary. And as a minister of health, I really want to say that I will forever remember the effort by each and every one of you. And again, the permanent secretary and the other heads of department for holding the fort. I mean, I remember when the PAHO director came, she said that they're going to have to get a residence in Roseau, because every time there's a disaster in my area, I forget I'm the Minister of Health. But we need to understand also that I live in Granby. Granby was cut off for a week or so. And I want to really thank the PS and the other heads for holding the fort in my absence in the immediate days. Just a quick update, especially as I spoke about Martinique and how they've been very helpful to us. The Honorable Parliamentary Representative for the Grand Fond constituency, I think Mont John Riviere Syriac, I think it's called Mont John Riviere Syriac constituency, and also the Parliamentary Secretary within the Ministry of Health. I like to refer to him as my level-headed deputy. I tell people he is a calm voice, while sometimes I can be a little out of control, for want of a better term. But we know that he would have been in Martinique for the better part of probably 4 months prior to Maria. We know that he would have suffered a massive stroke. But I really want to reassure the nation that the recovery that Honorable Stevenson has made is really remarkable. Even the doctors in Martinique, of many years' experience, okay? They've been amazed at the recovery that he has made, such that he is due back on island this morning. Which is why sometime during the course of the next few minutes, I will have to leave this really wonderful ceremony to go receive him, of course, as his colleague and the Minister of Health. So he's due to disembark sometime during the course of today to continue, of course, his medical management here, mainly physiotherapy, among others. So I think this is wonderful news for myself as his colleague. We entered politics together, he and I. Both of us came from the medical profession, he being an environmental health officer, and I'm sure for his family, and also the residents of the Mont John Riviere Syriac constituency. So, yeah. So thank you very much. Yeah.
We thank you as well, the Minister for Health and Environment, Dr. Kenneth Daru, also the Member of Parliament for the Petite-Savanne constituency. And thank you very much for giving us that update on the Honourable Ivor Stevenson, the Member of Parliament for the Mont John Riviere Syriac constituency. Very good to know about his progress. At this time, ladies and gentlemen, I will call on the next speaker to the podium, the Chief Medical Officer, Dr. David Johnson.
Thank you very much, Mrs. Kamala John Baptist Aaron, my good friend, staff of the Ministry of Honorary Staff of the Ministry of Health. Okay, thank you again, Honorable Minister for Health and Environment. It's very difficult to follow after the minister speak, but I'll try my best. The Permanent Secretary of Health, Mr. Davis later, other heads of department of the Ministry of Health, the press secretary or press advisor, the media houses that are tuning, the public, good morning. I'm pleased to be part of the Honorable Minister of Health team in this official press brief of the Prime Minister's office. This is the second such press brief that I have been invited to be part of. I think I said probably in different terms in the first press briefing, but I will say again, I tell people that Mario was too weak to knock us down and to keep us down. So the health system is recovering and continues to provide continued quality service to the population of Dominica, both at the secondary care level and the primary health care level, which our director will speak to detail to in a moment. And I would like to continue by saying thanks to the leadership of this country, the leadership of the Ministry of Health, the Honorable Minister, the staff, administrative staff of the Ministry of Health, and all of the staff of the Ministry of Health. And when I say staff of the Ministry of Health, I'm referring from, as the Minister indicated, from yardmen to cook to pharmacists, to every single person that is involved, whether directly or indirectly providing health care service or ensuring that health care services provided to the persons of the Ministry of Health. And I'll speak to our volunteers, which I'll speak to a little bit in a moment. And also to the wonderful persons who have been volunteering at the site we have in Newtown, Mr. Errol Thomas and Mr. St. Clair and his team, for ensuring that all of the supplies that we get are speedily distributed and efficiently distributed and accounted for where they are stuck at the former primary school at Newtown. At this moment, what I will do is probably just bring you up to speed in terms of what is going on at the Princess Margaret Hospital, but focus to some extent, taking up from where the minister has left off in terms of some of the recovery effort and where we intend to go to speak to some of the specifics. So the hospital, as I said, continues to provide emergency medical service to the population. The accident and emergency department is fully functional at this moment. We operate on, although we have limited staff, but we operate on a flexible shift, sometimes 8 to 12 hour shift is in place for nurses. The radiology department of the Princess Margaret Hospital, the services are functional, so we have X-ray, plain X-ray, ultrasound, our CT scan is back and running, fluoroscopy is also functioning. The medical ward, we remember in the first press briefing we had some dislocation of the medical ward, so I'm pleased to report that the male and female wards are separated and housed on original wards. The obstetrics, gynecology and neonatal unit, antenatal, neonatal patients are housed on the antenatal section. We have the operating theater in maternity unit is fully functional. Emergency cesarean sections and normal deliveries are being performed on a daily basis before, during and after hurricane. And the majority of our mothers are postnatal mothers and children. That unit is being renovated, as the minister alluded to. Surgery, unfortunately, only emergency services are being performed at this moment, and we will announce in the near future when elective surgery will resume. All the 3 main operating rooms are repaired. So we have repaired the main operating room, and they will be due to be commissioned or to reopen very shortly. Male surgical ward has been moved back to the original location. Our ICU, the original location was destroyed, and we are temporarily located in the Winston ward. So we continue to provide intensive care service to the population. Our dialysis, all our machines are functional, and normal dialysis services are ongoing. Oncology, the regular clinics are ongoing. We have some limitations at this moment with regards to the chemotherapy, the drugs that we administer, not in terms of the actual drugs, but where we administer the drugs to our patients. But we are looking at renovating that area and ensure that the chemotherapy continues. Psychiatry, this psychosocial support provided through the psychiatric unit is ongoing, and that is one of our strong points within the Ministry of Health. The team is not here; they're out in the district, and I suppose they will join us shortly. But the psychosocial support, which is absolutely necessary, is ongoing. I should also let you know that to date, the Ministry of Health and Environment continues to benefit from clinical services by several self-sufficient volunteer missions at the Princess Margaret Hospital and the primary health care level. Volunteer teams are mainly deployed based on the assessment of the areas identified for priority areas that we identify as priority areas. And currently there we have 6 volunteer groups, giving a total of 16 volunteers. But to date we saw, from the passage of Hurricane Maria to date, we saw at least a total of 188 volunteers, doctors, nurses, you name it, who came to the island to provide assistance to Dominica, and we want to thank them. Sometimes when you begin to call names, you miss some persons, but I just wanted to mention a few of them, although the minister did so, and I hope I don't miss anyone. We had from the Samaritan Purse, New York City Medics, the Team Rubicon, Massachusetts General Hospital, Harvard University Disaster Response. We had a team from Your Caribbean Nation Medical Mission. They came here twice on island. Hands International, they had several missions. We have the Israeli aid. Presently, they are providing services in the La Plaine area. Our good friends from Cuba, from Palestine, Venezuela, Barbados, we had Sandy Crest Medical Center, and also the Barbados Defense Force. Martinique, we had Samu, who was here. Trinidad, we have a team that is presently here and has been here since the passage of Hurricane Maria. Is there not a cause? We have Greenpeace, Pentecostal Assembly of the West Indies, Massey Foundation. We had persons from CAFA, St. Lucia, our sister country, St. Vincent, Jamaica, even from the Jamaica Defense Force, Bahamas. I hope I didn't leave out anyone in the list of persons that we mentioned. And if I do, I'm sure P&O will correct me. But ladies and gentlemen, I just wanted to let you know that Maria has greatly increased the health-related risks, including things like, I said so already, but we want to remind you, acute respiratory conditions, gastroenteritis, due to sometimes poor sanitation and our food safety. We are mindful in terms of our vector-borne diseases outbreaks, including things like mosquito-borne diseases such as dengue, Zika and chikungunya, as well as leptospirosis. And I will speak to some things that we did recently in terms of an assessment of our surveillance system. So we in the Ministry of Health, as I in my initial part of, I indicated that we are recovering nicely, but we're looking in terms of our, as the minister alluded to, has laid out some policy direction for us and the government of Dominica. There's a need to increase. We realize that there's a need for us to increase screening and to be more diligent in the management of chronic diseases. We have begun doing to some extent our self-assessment, and we have to do very shortly what we call a formal assessment of how we did, things we did well, things that we didn't do so well, and things we need to improve upon in the Ministry of Health. And after action review, as you call it, we are planning to conduct that very, very shortly. So in the medium term, the minister has indicated that, and we're going to build back, and we're going to build back stronger, and build back a country, a health system that is going to be a model to the world, a climate resilient health sector, Mr. Minister. That is the directive that the Minister and the Cabinet has given us. So in medium-term to long-term strategy to build resilience in physical infrastructure and health system, making use of affordable technology, health policies or strategies, legislation, as the Minister alluded to. We have to, and I'm not speaking a lot about it, but Primary Healthcare Director will speak to it. The primary healthcare system that needs to be revisited. We need to think in terms of from lessons learned from primary healthcare, how we strategize in terms of our 49 primary healthcare. If I left out one or added another one, the director will correct me. But we have learned some lessons that in terms of how our system, our health centers can be cut up, and we have to move forward. Human resource strategy must be reviewed and consideration given to expansion of environmental health services to make use of persons trained. We have conducted, with the assistance of PAHO, we have begun doing some self-assessment, introspection in terms of some things that we did. So we have looked at the overview of our surveillance system. And one of the things that we realize that we need to do in moving forward is to conduct a formal evaluation of a surveillance system. We have a surveillance system that is mainly focusing on communicable disease, and we need to, and we have already begun discussion with our partners, our external partners that give strategic guidance to the Ministry of Health, the Caribbean Public Health Agency, the Pan American Health Organization, and CDMA. It's not CDMA, I'm sorry, CDC. In terms of looking at our surveillance system to ensure that it's more robust. You need a robust surveillance system for data so that we can take proper decision. When the minister asks for information, or the prime minister, we need to be able to provide that information on a timely basis. So those are some of the things that Maria has taught us in terms of going forward. We need to review and revise conditions on syndromes being tracked, as I said, in a surveillance system. One of the things that we realize, and we, as I said, I'm looking in terms of going forward, in addition to what the policy direction the minister has given us, is perform a health emergency simulation exercise activity. Although the health sector, we realize, and probably we not blow old trumpet, I think we're fairly organized and structured in terms of our health. In terms of our health emergency operating center, but there's some lessons learned in there, and we realize that we need to move ahead and conduct a simulation exercise. We need to plan and ensure that we have more in terms of our reporting system, electronic reporting system. I know persons might question it. Paper-based, we're not going to get rid of paper-based, but we need to strengthen our electronic reporting system. And very importantly, provide periodic training and refresher training, monitoring and evaluation for our staff. So at this point, one of the things that we have done is even to look at, in collaboration with the Pan American Health Organization, as I said, our partners that are here for us, to look at even starting to put together a work plan. So we have looked at recovery, but we're looking at moving forward. Mary has taught us a lot of lessons. So we're looking at doing a complete laboratory capacity assessment. Our laboratory was affected in terms of its operation. Our laboratory service is back up and running. Is back up and running, but we're looking at from the lessons learned to ensure that we do a complete laboratory capacity assessment. We need to standardize in terms of our monthly reporting submissions. Data is important, information is important for decision making. We need to we need to look more carefully in terms of, or we have begun looking more carefully in terms of how we review our acute respiratory surveillance system. So in a nutshell, I hope that was a big nutshell or small nutshell. Following, I should end by telling you this. That following the passage of David some decades ago, Dominica developed a primary healthcare system which was a model to the world. Mary has come now And as the minister and the government has given the direction to ensure that we develop a resilient system, a climate resilient health sector. So that's what we're looking at. And so given this new normal of climate change, we are going to focus in terms of moving forward 6 things to strengthen our health system. In terms of our service delivery, we have to, our service delivery to our population, to make it more resilient, to ensure that we continue service to our population in spite of whatever strength hurricane that we have, and we are going to continue to have them. We need to strengthen our health workforce, our health information system, number 3. Our access to essential medicines, very, very critical. We need to ensure that we have medicines available on a timely basis for our population in spite of whatever disaster can. 5th, healthcare financing. The minister has already alluded to that. We need to ensure, as a direct policy direction given, our healthcare financing is robust. And the 6th pillar of where we are looking at in moving forward is our leadership and governance of the healthcare system. Without leadership, without governance, without legislation and strong persons to guide the sector, it means that all of those things can come through. And very importantly, the 7th pillar in terms of our where we are looking to move to build a climate resilient health system is to ensure that we have good and strong community participation. So in ending, what I can say to you is that we are building back. We are building back better, and we're building back stronger. And the mandate that we have as policy advisors getting from the policymakers is that we and Dominica, and all of us who are sitting here in this room are going to be part of that process. We are certainly going to be part of that process. Dominica, and this is the announcement that the minister has given and the government has given, and we need to implement it, that Dominica will be the first climate resilient health system in the world. I repeat, this small country of 70,000 persons, we had a primary healthcare system that's a model to the world. Dominica is going to be the first country in the world to develop a climate resilient health system in the world. Thank you very much. That's a question. Should I take the question now? Okay, just to repeat, health service delivery, we're focusing on that. Health workforce, health information system, access to essential medicine, financing, looking at our leadership and governance, and to embrace all of that to ensure that all of that is encapsulated with strong community participation. Thank you very much.
Thank you very much, Dr. David Johnson, the Chief Medical Officer. And to continue with the press briefing, focusing on the Ministry of Health and Environment, ladies and gentlemen, I will now call on sometimes a sector of the Ministry of Health and Environment that probably does not get enough attention, the environment part. And so let's call on the Chief Environmental Health Officer, Ms. Virginia Carbon.
Thank you very much, Mr. Aaron. Our minister has since left. PS later, our CMO, Dr. Johnson, other heads of the Ministry of Health and the media, the management team for the press, the Prime Minister's press brief. Everybody, good morning. Hurricane Maria damage and really gave a beating to the environment. We had all the supporting elements of the environment adversely affected. So we had our water system, we had our soil, we had our built-up environment with all our buildings. And what this did, it exposed us, the residents of Dominica, the population, to a lot of disease pathogens and hazardous material and exposed us to the elements of the environment that can adversely affect us. In response to Hurricane Maria, the Environmental Health Department started with looking at our water. Because although persons can stay without food for a few days, water is essential every day. And we want to really say our hats off from the Ministry of Health to the WASCO and to our WASH team, which we work very closely with during the first 2 weeks to restore water back to the communities in Dominica. The WASCO very quickly restored water to Roseau, where we have our highest density of population, and for that, we can say that maybe prevented us from really getting an outbreak of waterborne diseases. The WASH team is still out there providing us with water in areas that water has not been restored. So we have, most of the health districts have a number of communities where water has been provided, and in the areas where the WASCO water is not provided, we actually have the persons from the WASH team providing us with drinking water. So they truck drinking water on a daily basis to a number of the communities. We also had to try to get persons with less contact with the flood water. As we know, after a flood, we usually get an increase in diseases like leptospirosis, and that was one of our major aims, to get persons to have less contact with the flood water. Exposure to dust. So those first 2 weeks, we concentrated on water, exposure to flood water, and protection from the dust that was being generated because we had all the sand and dirt, especially in the city. During the 3rd week, we had to move on to food safety because persons started opening facilities, and we were mindful that with the type of situation, persons would not be cleaning adequately, and we still had a number of organisms maybe in some of those facilities. Some of them had no water, no proper storage. So we had to start with our food. So we came up with this situation where we started re-registering our food facilities and giving those who met standards a certificate of approval. This is ongoing, but it is now a situation that we have dealt with the emergency of those who opened without permission, and now we actually have a system in place where persons come in to inform us, and we go out and do an inspection and determine whether they are ready. We have also been monitoring our shelters, and we can say here this morning that we have seen the shelters decreasing very rapidly, in fact, as people rehabilitate. We are also seeing the numbers in the shelters going down. So as persons return to their homes, we are seeing less persons at shelters. However, we continue to do daily monitoring of our shelters because, as we know, when persons are in a crowded area, we also get the transmission of diseases. So we have to continue with our monitoring and surveillance of the shelters to ensure that they do have potable water, that they have means of sanitation, proper sanitation, and management of their waste. Okay, we also have vector control. As you know, Dominica, dengue fever is endemic in Dominica, so we always have a few cases of dengue fever. And with the breeding places having been increased so much after Hurricane Maria, our role was to reduce the breeding areas. So although we had a lot of complaints about the increase in mosquitoes, which was mainly Culex, because we have the Aedes mosquito, which is very important to us in the Ministry of Health because they transmit a number of diseases, as Dr. Johnson mentioned. Dengue fever, chikungunya, Zika, all these are transmitted by the Aedes mosquito. We also have the Culex mosquito, which can transmit disease but is not responsible for any disease in Dominica presently. But that is the mosquito that we are seeing in abundance. So the department has a team of persons, and we are going around and actually treating some of the drains, getting some of them opened, treating the basements. We did quite a bit of that. And as persons continue to complain that they have an increase in mosquitoes, we are doing assessments to find out where the breeding are and to really respond. So far we are keeping our fingers crossed as we have not yet seen an increase in the number of cases of mosquito-borne diseases, and we are keeping our fingers crossed that it will remain that way. So one of the things I want to say to the listening public out there, that we also depending on them as usual to get rid of the breeding around their environment. So in your homes, although we store much more water, we want persons to remember that they have to cover those drums. You have to turn over those appliances that can contain water and that can go on to breed mosquitoes, as we continue to work feverishly with solid waste and our other partners in removal of the waste that has accumulated after Maria. We also have been looking at our rodent population, and thanks to the people from the government and people of Cuba, we were able to bait the entire, in fact, 6 of our health district. Only La Plaine was not baited. And from all reports, in fact, persons are coming to our department by droves to ask for the rat pilau, because persons, it has worked so well. And persons are so happy with the way it worked that they are actually asking for more. But unfortunately, we do not have any more of the bio-rat. We now have weather blocks that we assist individuals with. Okay. The environment, we in the environmental health department, we continue every day to get emergencies. We are now dealing a lot with occupational health and safety. So as the days go by, we try to bring in another area of environmental health. Over the last 2 weeks, we have been dealing a lot with occupational health and safety, as persons try to return to their homes and their institutions, and they get sick on when they return. And we are now dealing with our mold problem in our buildings. The rain from Maria and the uncovered roof cause our buildings to have a lot of water. The water has adversely affected the buildings, and what we are seeing now is the growth of molds. Now, when molds grow, they can cause us to get ill. We get allergic reactions to the growth of molds, and especially our respiratory systems gets affected, and sometimes our skin. We have a few steps. The people out there, everybody who is affected with molds, there are a number of steps that we have to take. One of the first things we have to do is we have to stop the flow of the water. Whichever water is affecting the building, so if it's through our roof it's coming, then we need to cover our roof. If we are not able to use zinc material, we maybe need to get some tarpaulins, but we need to stop the water from coming into the building. If it's on the ground, we maybe need to do some drainage, but we need to get the water. We do not need more water coming into the building. So we first of all have to stop the entry of the water. After we have stopped the entry of the water, we need to remove the things that have been infected with the molds. So we go through our building, make sure that we protect ourselves. We protect ourselves with protective gears. We use our mask, we use our gloves, we use our boots if we still have water, and we remove the things that have been affected by the molds. And the wet things, if we have carpeting on the floor, we need to remove it. If we have cupboards with molds, we need to remove them. The paper, we maybe need to put them in the sun to dry. But we need to remove all the stuff that actually can cause the molds to go. We remove and then we clean. In cleaning, we have free chemicals that we use, also free substances that we use. We use pure vinegar, we use borax in water, and we use bleach in water. So we have this by a step-by-step process that the Ministry of Health has prepared a press release that we will be releasing maybe later. If not today, well, early next week, we'll be releasing that actually gives you direction on how to go about doing everything that you need to do to get rid of the molds in your building. We are going a step further. We have asked the Caribbean Public Health Agency to assist us in doing some testing for the molds. So we might be getting a team coming down to Dominica to take some samples so we can be aware of the serotype of the mold that is actually in our buildings in Dominica. So what we want to say to the public out there, if anybody has a reason and they want to get some information, they can contact us at the Environmental Health Department, and we can give you direct information, and we can maybe do an assessment for you and give you some information. We also want to say that once you have cleaned, it would be very good if you could come back to the Environmental Health Department to get an assessment and evaluation of what you did before you start using the building. Because what sometimes happens is that you get relief for a few weeks, and then if it was not properly done, then the molds might return. Okay? The minister spoke about our situation in Loubier. I just want to maybe talk a little bit about the situation, but maybe talk about some of the things that we in environmental health, in the Ministry of Health, recommended, and maybe some of the effects of what the ammonia could do to us, all right? Because in truth and in fact, we in the Ministry of Health found ourselves in a situation where it was anything that we did could result in adverse effects. We had to make the decision whether to go along with approval of is choosing between the environment and the safety of the individual. As you know, the population would definitely be of greater priority. So we had to go along with getting rid of the ammonia. As the minister mentioned, we are getting rid of it in a solution form because ammonia has a pH of 14, which is the highest scale on when you look at the pH scale, the highest when it comes to base, alkaline. Okay, and if it gets in contact with any acidic chemical, which they have, or they also have in the compound, because we have other chemicals in the compound that we are going to be working with them to also dispose of. It can cause a lot of damage, and it would maybe results in death of our people in that area. So we had to take the decision to dilute the ammonia and dispose of it. It is an acceptable system of disposal for the ammonia gas. You bring down the pH. They wanted, we had some of the things we asked them to do is to make sure that they brought down the pH to 8. They wanted to have it a little higher, but our standards in Dominica say 8, because at 8 we will not have things like fish kill, and we didn't really want to have fish kill in our river, so we asked that they bring it down to 8. We also asked that the temperature be not more than 30 degrees, because we did not want Celsius, we did not want to have the temperature also affecting the fish. Higher, it might end up with, the standard is 33, but we wanted to ensure that our fish life remains safe, so we asked them to bring it down to 30. Okay, we are also doing monitoring of the water to ensure that the pH is at 8 or below, and we will be doing that every 20 feet. At every 20 feet, we will be measuring the temperature and the pH. We ask also that the flow rate of the river, to make sure that we have the river the capacity to receive, the receiving environment has the capacity to receive the 113 gallons of ammonia that we have. Okay, so we can say that the community was alerted, the community was evacuated, and presently we have a team of persons on the ground doing monitoring and working closely with the persons who are doing that. I just want to say we found ourselves in a very difficult situation. The action that we take can have environmental consequences. However, if we did not dispose immediately, we could have had consequences to the population, which we definitely did not want to happen. So we had to make this choice. Okay? We just want to say to the people out there that all precautions is being taken, and we are keeping our fingers crossed that everything will go well. Okay, so we in environmental health, we continue with our monitoring and surveillance, because our role as environmental health is to protect the public's health, and everything that we do is in an effort to ensure that persons do not come down with disease. So we will continue to go out there and to do what we are supposed to do. We want to continue to ask for the support of the general public. Every time we come to your place, we are coming to try to help you. We also want to ask the persons who have animal pens pig pens and fowl pens. A number of them were creating nuisances in the environment before Maria, and we noticed that persons wanted to quickly rebuild those things. So we are now working with persons to really ask them to come back to the department and, ask to build, make a proposal, bring us your plans, bring us your area where you're going to, so we can do an assessment and we can say whether you can build in the environment that you are going to build, because they can create a number of nuisances that we continue to get complaints about. We also have our garages that are usually set up sometimes without planning permission, and therefore they are in an environment that they are not supposed to be. We also ask the persons whose garages has been destroyed to contact the environmental health department so that we can do assessment, so that we can give you some recommendations on what you can do. So once again, I want to say thank you to the people from the management of the Prime Minister's brief for the opportunity to address the people of Dominica, and we will continue to do the things that we are supposed to be doing. Thank you.
We thank you too, Ms. Caban, Fidinia Caban, the Chief Environmental Health Officer. And we now get to the final speaker before we take questions from the media, and that is the General Manager of the Dominica Solid Waste Management Corporation, Mr. Florian Mitchell.
Thank you, Mrs. John Baptist Aaron. To our Minister of Health, is not present, but I want to say a special thank you for all the support. Permanent Secretary in the Ministry of Health, also the Director of our board, Mr. Leta, Chief Medical Officer, Acting Chief Environmental Health Officer, members of the public, both visible and in the invisible audience, my fellow heads of department and in the Ministry of Health. Pleasant good morning, and again thank you to the Prime Minister's press brief, giving us the opportunity to at least spend a few minutes with respect to waste management post-Hurricane Maria. Waste management basically is a result of two economic activities. One of the consumption of household commodities, and that of manufacturing of goods by firms and industries. And as we saw on Monday, 18th September 2017, we saw an influx of waste throughout our island that would require a lot of help, not just from a solid waste management standpoint, but all other stakeholders. And in so doing, we saw the role of the Ministry of Public Works with the whole concept of removal of debris within the city. I mean, the role of the solid waste management entity basically is that for the removal of municipal solid waste, which is what our residential would put out. But when we saw the high level of silt, galvanized wood, it would command a greater level of cooperation between all the major stakeholders. And to that, I want to thank again the Ministry of Public Works, the Ministry of Tourism, the NEP for the role that they played in ensuring that the material that we saw in our streets within the city and throughout the island was managed in the best way possible. Due to the extent of devastation that we saw following the passage of Maria, our networks was severely impacted. And knowing that there is only one central landfill, we had to quickly decentralize our operation to allow for the material within our community to be dealt with in the most applicable or pristine way possible. Given the situation in the north, we had to reopen the Point Wrong landfill. Also, within the south, we had to use the Geneva area to receive material because of the impact to the road network. At those facilities at Point Wrong, I mean, seeing the level of impact and the amount of zinc that you had to dispose, we set up the area that we could receive zinc in a particular location, the MSW, which is your municipal solid waste, in a particular location, and the wood in another area. Again, the same operation at the Geneva area. You'd notice that we'd have galvanizing in an area, we'd have wood in another area, and also that of the MSW in another location, just to allow the general public to transport the material from their homes or from commercial entity to that particular location. Because of the road network, it was very, very difficult to truck material from one location to the next. From a storage management standpoint, as the minister made mention, one of the many challenges is that of equipment. And what we did and we've been doing prior or pre-Maria, we've been engaging a lot of private contractors in terms of bridging the gaps where waste management is concerned. And immediately after that, once the road networks in some of the rural areas was okay, we started engaging contractors to start hauling material from those different communities to the approved locations. And what we went also further as to not just having the locations, but having individuals to man the locations. Because, I mean, if you were to have an area in a particular community and there is no personnel, you'll have people dumping in an ad hoc way. One of the things that we've noticed in the cleanup operations, not just throughout the island, there are multiple players involved. And one of the things that we're asking the general public to do is to separate the waste or the material that they're putting out. We receive extensive damages to our homes. Many people will be removing or cleaning their homes. Separate your material. Place your wood together. Place your galvanized by itself, your MSW by itself. That would allow for the cleanup operation to be more speedily. It will be done in a more cordial manner. Imagine having a stockpile of material mix. I mean, you have different crews collecting different material. There is a crew collecting galvanized, there is a crew collecting wood, and then the storage management entity collecting your MSW. And one of the things that we've seen in many, many communities is a stockpile of all the material in one pile. So imagine solid waste coming in there, taking the plastics, then somebody has taken the wood, and that makes it a bit more challenging. So we want to appeal on the general public to ensure that they separate the material. Again, in separating material, it makes it easier to tip the material. But what we've noticed is that a lot of the vehicles who are carrying the material from one location to the next is tipper truck that are utilized. And we have seen instances where the material would come to a particular location, but because it is mixed, the individual who load that material have to physically remove the galvanized, put it down, then put the wood in another area. And many times the people within the facilities, who are manning the facilities, or who are utilizing the facilities and manning the facilities, they would have some level of miscommunication as to what goes where. And that is why we're asking the public, if you separate the material, the whole process of trucking and disposing would be very easy. If you come to the Focally Sanitary landfill, we only receive MSW or white goods. We do not receive wood in that area, we do not receive galvanized in that area, because the stock farm landfill, which was closed, was open to receive all your zinc material, all the material in terms of wood. Those areas was designated for this material. So again, in going forward, we really want to thank the general public for partnering with us. I mean, within the city, I mean, there are a few things that we've noticed within the city. And waste management is not the sole responsibility of the solid waste entity. As is enshrined in Dominica Solid Management Act, any commercial entity, based on the definition of the law, is responsible or mandated by law to dispose of the waste themselves. It is not the function of the Ministry of Tourism, it's not the primary function of the Ministry of Public Works or that of the corporation. I mean, given the devastation that we've seen after Maria, I mean, we really appreciated the individuals for cleaning and putting the material out initially for cleaning and storage and disposal. But as we have seen with Roseau, and we've seen the improvement in terms of how clean the city is, we are expecting, or we're calling on the commercial sector, that if you're doing any further cleanup, that you should truck your material to the approved sites, as opposed to having the material placed out on the curb or on the vacant lots in the city. I think that is something that we should discontinue with immediate effect. I mean, in the initial stages for the first 2 weeks, I mean, we tolerated it, we allowed it, because we saw the urgency to help. But I mean, the road network is good now. The city is a bit cleaner than what it was. I mean, there's a vast improvement, and we're calling on every single individual to play your role in ensuring that your environment is clean. I mean, we could go and speak on to all the vector-borne with formal waste management and all those things. We don't want to go in those areas. But what we're saying there, the role is your role, it is your responsibility. It's my responsibility to ensure that my community is clean and that the nature aisle is clean, green, and beautiful. The minister made mention of the government's intention. The Ministry of Finance, through a World Bank consultant team, prior to Hurricane Maria, that was probably since 2015, 2016, contracted a World Bank team to look at waste management and to see how we could revamp the whole waste management system in Dominica, seeing the many challenges that we've had. And as was seen in this year's budget, we saw additional finances was made available to the corporation in terms of subvention and also that for capital investment, because the Ministry of Finance saw the need to improve on the current system of waste management on island. I'm just going to read a bit. I don't like to read from what I write, so forgive me. I always have my notes, but then I will just speak from what I know that is applicable or is being done. The plan basically with the World Bank was to basically increase the budget of the Dominica Solids Management Corporation to ensure solvency and in the meantime to fill the gaps into improving the present system of waste management on the island. And the proposed strategy would be to reestablish the service while building back smarter. And if you notice, in an island, 70,000 in terms of population, our waste stream is not significant. But given our road networks over the years, and we saw what happened in Tropical Storm Erica, and then we have Maria 2 years after, we have seen significant damages to our road network that affects waste management. And in looking and building back smarter, one of the things that we're looking at is the whole concept of decentralization. And in decentralizing, you would have cut down a lot of your maintenance costs in terms of hauling material from a particular location. Imagine hauling waste from Portsmouth to Fort Coley. If you were to have a transfer station in the north, or if you were to have a mobile waste-to-energy plant in the north end, that would allow for that material to be dealt with through incineration or through a transfer station. So in going forward, I mean, those are some of the recommendations that are on the table. I mean, the minister made mention of it in terms of outsourcing, in some of having formal contracts with private entities to engage the commercial entities to see how we could improve on waste management on the island. I think I will stop here, but I want to say again, special thanks to my staff for having worked under trial circumstances. I mean, we do not have any facilities at our landfill, and yet still our guys are out there working every single day. And primarily our collection system, we run basically mainly within the morning because of the lights in the communities. But also we run a nighttime shift within the city utilizing Bobcat to ensure some of the backlog in some of the communities are cleared. And I want to applaud my guys. It's not the best situation, but they're out there every single day trying to bring normalcy to the collection system. Again, in closing, we've been speaking a lot prior to Maria of the need for separation, and we want to again appeal to the general public. I mean, if you could separate your waste, we have a full-fledged equipment that is designated for the collection of recyclable material. It only collects glass, cans, and plastic. It does nothing else every day, Mondays to Fridays. That is an additional service that we offer to the general public, and we're asking the people to take advantage of that service. Separate your material. What we've seen, I mean, we have a lot of water in terms of relief, in terms of PET material. One of the issues that you will experience with PET is because of how bulky it is, you may not have a lot of storage area. But what we're saying, you could just take that bottle, I'm seeing one at the back, you just shrink it, twist it, it goes down to about half of the size. That would increase your storage. And again, yes, my good friend Dexter wants me to do a small demonstration. I mean, you just, this is PET. Once you twist it, you put back the cap, you reduce your volume significantly. And given the issue with our houses and no roofs, Storage is an issue. Your cans, you could use a hammer. You could just pong it, make it smaller. I mean, you reduce the potential of it having water, all those things. Your compost material, your food peeling. I mean, dig a hole, bury those things. I mean, if we have children, elderly folks, I mean, we'll have those soil stuff. I mean, that will create a problem. And again, after the passage of Maria, we've had to reschedule our collection system, and we're asking the people to adhere to the collection system that is out for your community. I mean, some of the communities we had to rescale to once a week collection, and many of the communities, after we've cleaned, we've seen people put garbage out after the collection equipment has passed. I mean, we're saying, let us keep our nature island clean, let us help. We want to serve you. It is our responsibility to serve the public, but the public in itself has to ensure that they follow the procedures that is set out by the Waste Management Authority. Our number is 449-8168, 448-6839. My number is 616-8170. This phone is always on, it's always ringing. You could text me, you could WhatsApp me. Any concerns, any challenges, we are willing to serve you. Thank you very much.
Thank you, Kambala. Excuse me. Good morning, everyone. Julian Morris, Channel 5 News. Now, you all have given us a tall order here. There's a lot of information to wrap your mind around. A lot of speakers, lots of information. However, one of the more pressing things for me, and I think for the people in the Lubia area, would be the situation they are facing right now. And according to the minister, he said that they found out a few weeks after Maria, they were informed about the ammonia. He said that they were assured at the time that it would be safe in containers. He said subsequently, a week ago, they reported small leaks and so on. What my concern is, and probably would be the concern for the people in the area, is did we at any point know prior to that we had a potential problem there? We've learned from today's press briefing that there are other chemicals there as well. Is there a protocol in place for companies such as this one to dispose of these chemicals in a safe way? Is there something in place, and who is monitoring it? Is environmental health monitoring? Do we know if these companies are adhering to whatever protocol there might be? So this is where my concern is for environmental health. I don't know if Miss Carbon can address that, or yes.
Please go to the podium.
Okay, when it comes to the urgency of the situation, maybe about 4 to 5 weeks ago, we knew that there were chemicals at Kubuli. As far as we knew, the chemical was properly stored, and they needed to transport the chemical to another location in Belfast. The persons environmental health we knew of that about 4 weeks ago. They came and they said that they would need transportation to transport it to Belfast. However, we said that if we were going to transport, there were logistics, and we would definitely have to involve the police and the fire people, because environmental health would not be able to really arrange for transportation or do the necessary monitoring. So it would have to be a team effort. The gentlemen left the island. We did not hear from them again until from an environmental health standpoint, we didn't hear from them again until we knew of the emergency situation. The other to continue, the other companies in Ireland, we have decided to do an assessment of the other areas to ensure that, to find out what conditions the chemicals that they have on island is being kept, and so that we can give them the necessary advice.
Just to follow up, just before Jyoti asks this question, you all have to be commended that there is an effort to perhaps dilute the ammonia, but you said it was basically trying to protect humans versus maybe damaging the environment, perhaps. But what happens? Should we be warning people who might want to maybe bathe in the sea? Perhaps this is going to be going through the river into the sea eventually. So should we be concerned there? Should we?
No, we do not have concern there. As you know, you maybe have heard the term of dilution, dissolution to pollution. So we are diluting it to a stage where it's not going to affect. The thing is, it's an irritant and it would irritate our lungs. So we would get things like burn blisters through our respiratory system. So we would get blisters on our respiratory tract and all of that go down maybe to our lungs. So that would have been the concern if we have a pH of above 8. So because at 14, that is what it would cause. So that was the reason why we asked that the pH be brought down to at least 8, so that we know at 8 it would not really affect the population. And they wanted to use 9. They wanted to bring it down to 9, but we wanted them to use 8 because we were trying to protect the organisms in the river, so we would not get any fish krill or any of our other minute organisms that are in the environment of the river.
We saw occasionally I would go through that way since following Maria, and I would see people bathing, washing in the river. Do we have any concerns about this?
What is happening is contained in the building. Okay? What was the concern and why we had to really rush into doing it today at short notice is because we had started seeing an increase in the amount of ammonia in the air within the facility. Okay, we did not have a problem. We have not seen a problem in the environment outside. But within the building, when the gentlemen came and they realized, because the thing is, even if you have a liquid ammonia, anytime it escapes to the air, it turns into gas. The gas is colorless, so we not see it, but it has a pungent odor, so you would actually smell it. Okay, if it mixes with the as I said, the acid chemicals that we have there, it can really cause a kind of something almost like an explosion, So we needed to get rid of it. The pipelines that it was used as the refrigerant for the products that they were manufacturing. Because we couldn't officially say that we had a leak because we were not seeing a leak. However, we felt that because the ammonia remained so long in the pipeline, it must have affected the valves and so in the pipeline. So we had small leaks because we saw an increase in the amount of ammonia that was being released in the building itself. So that is one of the reasons we could not wait so that it might end up getting out in the atmosphere and affect the communities that was really living close to Kubuli. So that is the reason why we had to take this quick measure.
What happens to the ammonia, the stuff they take to Belfast? What happens to that?
Well,
Do you know?
we are not taking anything to Belfast. Belfast was... No, that was the plan in the beginning. When they came down, they said they were looking at the chemicals they have, and the plan was to transport it to Belfast. However, when they came back, they actually had to deal with that aspect of it.
But you're satisfied with these things there?
Yes, well, the thing is, it's an internationally accepted process that you dilute the ammonia, you bring the pH down, and you try your best to dispose of it.
For Mr. Flora, I notice a lot of emphasis has been placed on the management and waste management and whatever it is, and how you go about diluting, if that is the proper term in this circumstance, to get people to understand that they've got to separate their waste. How satisfied are you that the message is getting across, and are you seeing the results of those messages? I mean, people are really taking into putting their separating their waste, and is it getting the effect that you really would like to see it get?
If I were to answer from my own perspective, I would say yes. I would want everybody to tomorrow just separate all the materials. I mean, from me being someone who deals with waste management, that is what I'd like to see. But the educational process takes a lot of time, and many times, if you notice in Europe and developed countries, recycling is not something that is it is mandated by law that you separate your material. And in small island developing states, despite our many challenges with waste management, legislation is something that we need to couple with any initiative that we implementing. And to be able to see that greater participation in terms of separation, we need legislation to support. We cannot just purely leave it on the goodwill of the general public for education to get it done.
Have the legislation in place?
We should, to help us achieve the level of separation that we would have. We have recycling programs within the Pava State area, the Central Roma area. We're seeing the general public separating their waste, putting it out. We applaud that. But what we're saying, if we had the legislation in place, it would ensure that you could go to somebody and say there is non-compliance according to the law, you should be able to comply, so and so. Then we'll see that greater level of participation in terms of putting out the material. Yeah.
Dr. Johnson, you spoke of a 7-point plan, is that? 7 pillar? No, I have 7. Strong community participation was the 7th one. I would like you to speak to those 7 points in more detail for us, please, because just telling us about it doesn't seem to satisfy us too much. We would like some more detail as to the 7-pillar plan that you have, or that is is envisaged for the continued development, as we say, of the health sector.
I thought you had asked my question, that question already, but that's a big. Okay, thank you. Just to summarize, this 7 blocks or plan or pillars, as we indicated there, they are not totally new to the health system. In fact, they're the 7 pillars, more so 6, 7 one is added. That is established by the Pan American Health Organization in terms of strengthening a health system. We are going to conduct assessment. Okay, whenever you're developing a plan, first thing you need to do is to conduct an assessment in terms of get all of your facts right, and then say exactly what are the problems are, what the challenges are, and then develop a work plan. Okay, so service delivery, let me just speak to them very quickly, because service delivery is how we provide the service, the type of service we provide to the population. Okay, all right, both at the primary health care and at the secondary health care level. We need to be able to do better how we provide services, and to ensure that that our services continue to run as smoothly as possible during a disaster and after disaster. So that is easy, right? Workforce. We need to ensure workforce is, I guess that one's simple as well. We have a number of persons providing healthcare services, and workforce doesn't only entail doctors and nurses. As I indicated to you, we have to thank everyone from cleaners to cook to pharmacists to what we call support staff. So a number of persons are within the Ministry of Health who are providing or ensuring that health services are delivered properly. We have to ensure that we have the correct numbers, the correct type, in the correct places, providing services to the general population. All right? Health information system. For you to be able to do anything, you have to have correct data, correct information. So we have to develop a system that is robust, that captures the information, that stores the information in a good and a safe area. So from data is transformed to information, and information is transformed to knowledge. All right, that's the process. So we have to ensure that for communicable disease, for non-communicable disease, for anything that affects the health system, we have to be able to retrieve it in a very timely and efficient way so as to move forward. Access to essential medicines, that speaks for itself. You have heard even before Maria just at the budget address that the Prime Minister, the policy direction was set out by the government in terms of even making more monies available for ensuring that we have more essential medicines. One such such medication or type of medicine, group of medicine would be the cancer medication based on the problems that Dominicans are faced with. Right, so that's the fourth. Financing. I mean, the minister speak about it. I mean, we have to ensure that we have a robust healthcare financing for the health sector, because health is something that consumes a lot of money. Some people look at it as it's not a revenue generating, it's a social sector, but at the same time keep people well to produce money in the population. So we have to look at, and the government is looking at how you can strengthen the financing system for health. You have heard prior to Maria the idea of the pilot national insurance scheme, and rolling out a robust financial system for the Ministry of Health, or for the health sector. And leadership and governance, I hope that is self-explanatory. To drive anything, you need persons to do it. You need persons to champion it. Governance, this sort of structure that you have, and that would come with legislation as well. The minister spoke with regards to some our legislative agenda. Their policies and their legislation to make sure that things happen, and things happen properly, and hold persons accountable, etc. So I hope I did a fair thing in terms of explaining what those 6 things mean, Mr. Ross.
Yes, as we speak of financing and leadership and community and communication, this next question is for P.S. Later. In your presentation, sir, you did make mention that there was loss of over $18 million to the sector, but you would need approximately $60 million to bring it back. Explain that disparity.
Okay, to explain, you're talking about the damage and loss. So you're talking about damage to buildings, damage to equipment, etc. We very simply, to replace what is damaged, it's going to cost a little more. Even for your simple house, you would realize to replace what may be damaged in your house is going to cost you more than actually because the price of things have gone up. In addition to that, we're not just looking at going back to where we were at Maria, but we're talking about building better, building back better. That is the word that we've been talking about. So if we're talking building back better, and as the minister indicated, building, developing a climate resilient health system, it certainly cannot be the same 18 million that we're talking about. The details of that almost 60 million would be contained in the PDNA. I mean, at this point, I'm not going to go through the details of all the cost, but you're looking at things like efficient, improved energy systems. We're talking about smarting our healthcare facilities, as the minister indicated some of that. So it certainly is not building the roof back as it was, giving you back the same facility as it was. So that explains the increase in costs, my friend. Thank you.
Any other question?
Yes, I have a short question.
Go ahead.
Post Maria, we had, if I'm not mistaken, a number of patients, evacuated for medical care overseas. I just wanted to get some sort of status on them, how they're doing, and do you have any information on that, or am I asking the wrong question in the wrong place?
Thanks for that question. We have a number of patients, and thanks to the assistance, obviously, the government of Dominica, and also to PAHO, which assisted us greatly in evacuating a number of our lifting a number of our patients. Some of them have returned home. Some of them are have done well. We have had, and we have contacted the families in instances where we had 1 or 2 deaths for some of the persons who went overseas. All right. So we can account for all of the patients. All right, and we are in collaboration with Pan American Health Organization (PAHO), just coordinating and giving us constant status report of those patients. And if any unfortunate circumstances arises with those patients, the first thing we do is to contact the families of those patients and to give them an update of those patients, to let them know what has happened or what is happening. I hope I have done justice to that question.
Thank you very much, ladies and gentlemen. This brings to an end the press briefing for today, Friday, November 17, which focused on health and environment. Although he's not there, I will start by saying my thanks to the Minister for Health and Environment, Dr. Kenneth Daru, the parliamentary representative for the Pittit-Savan constituency first, the Permanent Secretary in the Ministry of Health and Environment, Mr. Davis Leighton, the Chief Medical Officer, Dr. David Johnson, and the Chief Environmental Health Officer, Ms. Ferdinia Carbon, and the General Manager of the Dominica Solid Waste Management Corporation, Mr. Florian Mitchell. All of these were podium speakers, but the other people within the Ministry of Health and Environment whom you did not see this morning were present here on site. I can let you know Dr. Laura Esprit, who is the Director of Primary Health Care here in Dominica, the Principal Nursing Officer, Cesarina Farrell, and also Mr. Dexter Francis, who is the Project Manager at the new National Hospital, the single biggest project that Dominica has ongoing at this time. Well, that was previous to Hurricane Maria. Dr. Johnson says it still is 109 million EC dollars in total. And so, ladies and gentlemen of the media, I thank you again for your presence. All those looking and following the proceedings, listening and looking, following the proceedings in general, here and abroad, we thank you also for your participation. One and all, have a great day.